Okay, so we're talking about staying well as we age. Now, I don't know if you probably aware of how much the field of longevity is exploding, and almost everywhere you turn around, there's a talk about longevity. We want to talk about qualitative health, staying well as we age, and looking at it in terms of more in terms of, okay, why should we be healthy to stay well as we age? And partly what I see is to sustain a reason for being when we have a reason for being and to be in alignment with that. So, conscious care for our health. So, we'll look at this in terms of three parts tonight: lifestyle choices, natural support, and then assessments to stay well as we age. So, I thought to begin with looking at assessments. So, assessments, I don't know if you're familiar with the Cleveland Heart Lab testing, inflammation testing. Now, it goes beyond just looking at cholesterol, which cholesterol can be an okay thing to look at, but it doesn't really give a full picture in terms of your cardiovascular health. So, the Cleveland Heart Labs out of the Cleveland Clinic in Ohio came up with this panel. So, it can measure elements of, you say the yellow is atherosclerosis building up in our bloodstream just by a blood test. But the kicker for me was this MPO test, where an MPO, if you have a high myeloperoxidase level, it can relate to having a propensity for having a stroke or a heart attack. So it's good to be, again, what we're looking to do is being proactive with our health. So having that monitoring tool to see where you stand and then seeing how to address that sooner than later. Okay? So those are the Cleveland Heart Labs. And then approximately 50% of heart attacks and strokes occur in patients with normal cholesterol levels. So we need to look a little bit deeper. So actually, Christine and Alan, I checked with a friend of mine who's in Edmonton, Alberta, and he was saying you can request an MPO test, but your insurance you may have to pay a little extra to have that done. Sure. Okay, so a foundational panel. So then looking at foundational labs, like a lot of folks conventionally, doctors take a CBC, probably have heard of that, complete blood count, which includes white blood count, red blood count, lymphocytes. Now, it's important to look at white blood cells, lymphocytes, monocytes, because actually looking at these two, you can see if a person has high monocytes in the health circles, we recognize that person might have some food sensitivities like to dairy, and elements like that that might kick up their immune system. Okay, if they have high eosinophils, they might have a parasitic infection. So again, looking a little bit deeper in terms of what each one of these elements show. But then you want to look at a lot of doctors take A1C now. A lot of folks know their A1C, and you want to have that less than 5.7 to be out of the pre-diabetic range. And then a CMP, comprehensive metabolic panel. Now, a lot of folks take BUN, creatinine, but in the panel that I look to run for folks and other doctors is checking for uric acid levels. And uric acid levels can relate to gout levels, to joint type concerns. And then also adding things like LDH. LDH relates to tissue breakdowns. If those levels are high, it can relate to the fact that you might have a pathology developing. So again, looking at a little bit deeper than just conventional lab work there. Thyroid panel, you want to look at thyroid antibodies when you have your thyroid looked at, because you just don't want to have just only TSH. You want to see if you might be developing an autoimmune condition by checking your thyroid antibodies. And then T4, T3 free. Then I'm looking at liver panel. Most doctors take ALT and AST, but GGT is another factor. And this factor can relate to how your body might be metabolizing or having an inability to metabolize alcohol, looking at that level, GGT. Okay, and then adding these elements to these testing, now ferritin, more doctors are taking that, but a lot of doctors leave that out. Now, ferritin is the way your body stores iron. If that level raises, it could relate to accelerating the aging process. So you want to get that checked. Then inflammation testing, SED rates, CRP, C-reactive protein, those are inflammation markers to have checked. Creatine kinase is another tissue breakdown level. So you can see if you're breaking down more tissue than you're building up. And then vitamin D. A lot more doctors are taking vitamin D. Alan and Christine, you tell me the doctors in Canada don't take vitamin D because everybody knows their levels are low. Is that right? Yes.
That's correct,
Okay.
Steve.
Yes, Christine. Okay. Okay, but we're looking to be consciously healthy and being proactive with our health. And being proactive is looking at cancer markers. Now, most doctors take cancer markers after a person has cancer, but why not check them before you have cancer to see where you might be trending? So again, these are markers, female cancer markers, male cancer markers, and sometimes you might say, I don't really want to know, but again, we want to be consciously healthy, to actually see where we're standing and then address things sooner than later. Okay. Now, one element I recommend even for men is to check estrogen levels, because if those levels raise high, that can also be a factor for developing a pathology like cancer. Looking at labs from a health perspective. So the labs I look at, again, we look at healthy ranges versus clinical. Your medical doctor will look at clinical ranges, and if everything is within clinical, they say you're fine, the line of fine, everything is normal. However, there's a narrow range of the clinical range, which is determined as the healthy range or discerned as a healthy range. And there's different ranges some folks have that are maybe slightly variable there. But if you look at it in terms of yellow, this says high, but that level there, that means they're out of the healthy range, but still within clinical. Now, for this person, their vitamin D level, now blue is extremely out of the clinical range. So if the doctor took their D, now this was a patient of mine, the patient, they had a very, very low vitamin D level. Ideally, you want to have at least a 50 level between 50 and 90. 90 actually could be a little high. So at least say 60 or 70 there. But they were starting to trend up with this cancer marker, CA 19-9, which is an indicator for pancreatic cancer. So after, I saw that, I put the patient on vitamin D. 9 months, 8 months later, their vitamin D went up to 89, which we needed to temper that back in terms of the amount of D they were taking. And their CA 19-9 lessened to 39. Now, it wasn't much less, but at least it was trending in the right direction. Okay. Now, a lot of folks as we age are curious about or want to keep their brain healthy, but to look at causes of cognitive decline have to do with inflammation, and inflammation comes from infections. Now, you've heard of amyloid plaques and Alzheimer's there, but that's been related to viruses, stealth viruses that you might have underneath the surface that might be causing the creation of amyloid plaques. Poor diet, those high in sugar, gluten, processed foods, again, autoimmune conditions. Gluten can trigger autoimmune condition for some people. So again, we want to look at foods and more of an anti-inflammatory diet. Decline of shortage of key nutrients. Now, there's one nutrient I've really been proclaiming. As we age, we lose 85% of our ability to make nitric oxide. Nitric oxide is required for red blood cell delivery of oxygen from the lungs to the tissues. Every single chronic disease is characterized by decreased blood flow to the affected organ and tissue. If you can restore blood flow and perfusion to every organ, tissue, and cell in the body, you can help most, if not all, chronic diseases. Well-vascularized tissues are more resistant to infections. By contrast, poorly vascularized tissues are relatively inefficient in responding to inflammatory stimuli, from Nathan Bryan, PhD. Toxic substances, conditions. Now, heavy metals, maybe you're familiar with heavy metal influences in terms of influencing the nerves. There's some videos about how certain metals can actually deteriorate nerves. So metals that are toxic to the nervous system, especially, are mercury, lead, aluminum, fluoride, known to accumulate in the pineal gland. The pineal gland is actually the gland that actually triggers all the rest of our glands, our pituitary gland. So we want to look to see at these conditions and the ways of checking these a little bit more in terms of how they might be affecting you. unrelieved accumulated stress. Now, you can say underneath it all is unrelieved accumulated stress, and that could be emotional stress, physical stresses there. So we want to see causes of cognitive decline and what can we do about them. So diagnostic markers for brain and heart, checking your blood sugar, A1C, fasting insulin, and glucose. Now, they talk about Alzheimer's being diabetes 3, related to folks with high blood sugar levels over a period of time. So, looking to see how you can bring control in that respect. Nitric oxide saliva testing. So, we just talked about nitric oxide, but there's a simple saliva test you can do at home to check your levels. Heavy metal testing. Now there's hair testing, urine testing, a little more specific, but you can screen your hair for heavy metals, and you should see metals getting out of your hair because the world is toxic and they should be getting out of our system. Neurozoomer, there's a test called the Neurozoomer from Vibrant Labs, and it's an antibody test for brain and nervous system. So you can actually see a variety of antibodies that might be attacking, you'd say, your blood-brain barrier or your brain itself, your cerebellum there. So there's a test for that. Blood test. I don't know if you're familiar with these tests. Is ATN profile. It helps to detect Alzheimer's related changes 10 to 20 years earlier. So again, I'm looking to share the things that I've become aware of, and there's a whole lot more that could be shared, but just making you aware that there's a test to see if you're developing possibly Alzheimer's related changes way earlier. Again, being proactive with your health. And then there's this pTau217, which detects early Alzheimer's type tau changes. Okay, tau changes are actually amyloid plaque being tangled up, tangles of amyloid plaque there. So checking those to see if actually they're beginning to happen in your system there, and then looking to see, okay, if they are, then what can be done now, sooner than later. And then health genomic testing, including ApoE4. There's a genomic test that relates to ApoE, and if you have what's called the four alleles there, that can give you a little greater propensity for developing Alzheimer's. But it's useful to determine specific types of B12 and folate for individual needs to help moderate homocysteine levels. Homocysteine, high levels associated with dementia, short-term memory, heart disease, and stroke. Okay. Okay, just going back here, just B12 and folate. Some folks take the adeno form of B12. Some people take the methyl form. Now, when you get tested genomic-wise, you can see which type is best for your body, either the adeno form or the methyl form. Same thing with folate. There's methylfolate and there's folic acid. So being tested can see which one's ideal for your system. Okay, genomic testing. So to me, this is the test of tests. This test can check to see basically baseline factors that relate to your mood and behavior. And again, you're probably already aware of your tendencies for mood and behavior, but it can kind of get underneath the surface to make you aware of other certain tendencies you might have, to make you conscious of them, to actually help you catch them in the moment. Cardiovascular genomics, some people are more prone to develop high cholesterol levels or inflammation in their system, and genomic testing can relate to that. Immunity and detox. Now, some people are compromised with detoxification. So if they had a hair test and shows that nothing was coming out of their hair, it could mean that their body doesn't have the genetic makeup to really help with detoxifying things. And the way the world is today, if that's the case, then supporting the person's body with some kind of detoxification methods, either lifestyle or through supplement factors, can be very helpful. Hormones and exercise. Now, with exercise, you can tell whether you have more of a propensity to have, say, cardiovascular exercise to help your system best, or more for, say, weight training or resistance training. Sleep genetics. Some people might need, you can say, an air filter in their bedroom because they might be disturbed by environmental factors there, which can sleuth that down, or they might be kind of just sensitive to time travel, time zone type things. Diet and nutrition, it gives an idea of what's happening in terms of how much fat you can tolerate in your body or how much carbohydrates you can take in. And then longevity genetics there. And it's actually, there's a test for a longevity gene to see if if you can have the potential to live a long time. Okay. And then how the genomic testing supports you is the genetic insights, you become aware of how your genes can compromise your health. So again, plugging up the holes. If you know your cardiovascular system has more of a tendency to generate cholesterol, then there's ways of addressing that. Personalized changes, identifying lifestyle choices for your immediate and long-term health, the field of epigenetics. Now, again, we're not subject to our genes, but we're actually more subject to the choices we make for our health. And that relates to the field of epigenetics. And we can turn on the good genes that we have, and we can kind of dim down the genes that might be not healthy for our long-term health or quality of health, immediate and long-term health. Targeted support identifies essential supplements for your body. Now, a lot of folks that come to me too, they can take a whole lot of different supplements. So this kind of brings it down to cases in terms of what their body absolutely needs to support their genetic compromises. Active monitoring discerns periodic testing needs. So you can see, for example, if a person has a vitamin D, they might not be able to use the vitamin D they take in, and there's ways to address that. So it can tell whether you need to monitor that level or even some other testing that can be helpful to see over time. So again, data insight leads to specific action. When you have the insight, it leads to specific action. But specific action leads to healthy results. So taking the action once you have the insight. Okay. So then looking at now lifestyle factors. We just reviewed testing, but looking at lifestyle factors, especially for your brain. The number one factor that I proclaim in my classes, and those who have shared in them, is that finding your rest activity flow balance. Again, just finding your balance between rest and activity. I think that's so central for all of us there, finding your flow in that respect. Enhancing brain health through prayer, meditation, music, spend time in nature. There's something called soft fascination time. Soft fascination time is when you may just stand in nature looking at the trees and it does something to your nervous system that allows for your mind to kind of down regulate there. Optimize sleep, incorporate regular times for relaxation, consider a bedroom air filter. Again, we spend maybe 6 to 8 hours sleeping in our beds there in our bedrooms, so it's a strategic place to have an air filter. Stay socially active and engaged. I'm sure most of you know how important that is, socially active. The number one factor, you can say, for the blue zones is a sense of community, for longevity, their quality of health, staying socially active and engaged. Do at least 30 minutes a day of enjoyable exercise, include resistance training. Now, cardiovascular is good, but some of us might be more designed for resistance training. And resistance training helps to raise what's called this brain-derived neurotrophic factor, which helps with mood. So something to be very helpful. Okay, and then movement with breathing. So I thought we'd take a little break here for a moment and do a little breathing with movement activity here. So let's just stop our share for a second. And this is a way of coming to presence. Maybe you want to stand for a second, if you can, if you're able to. If you want to just sit, that's fine too. Okay. I don't know if you ever done this. Who may have done Tai Chi? Who's done Tai Chi or yes, I see. Yes. Okay. Oh, when you move with and you breathe, if you move and you breathe, it brings you into a presence here. So either you want to follow me or just move your hands slightly and breathe as you move your hands. So just breathe, breathe as you move. Breathe as you move. One more time, breathe as you move. Okay, good, very good. I find that very helpful. to get into a state of presence. Let me continue on. Okay. Okay. And then doing brain enhancing exercises like crossword puzzles, Sudoku, language learning. Carol likes to do crossword puzzles. There. Maybe you do too. I like language learning. I like to learn different words from different countries. Like I can say hello in Korean, 안녕하세요. And then practice heart math, utilize the brain tap math. So I'll have a little more to talk about that, but sometimes having some tools too can be very helpful for our brain. I consider heart math and brain tap app to be very helpful. And then consciously eat and drink healthy. Roger was talking about a little bit in that respect there, but what we eat and what we drink is important, but how we eat and drink is probably even more important there. Okay. Natural support. So looking at natural support, some things that I've want to share with you that I found very helpful is using the nitric oxide assessment test strips to check your levels. And then there's foundational supplements that are beet-based. Some there's all different kinds with that, but there's ways of checking to see if they're helping bring up those levels. It opens up again, nitric oxide opens up the circulation. And then parent essential oil, plant-based omegas. This is plant-based omegas. They're not fish-based. So it facilitates the flow of oxygen from the bloodstream into the cells. So it actually helps to restructure the cellular membrane to allow for oxygen to get into the system. So the nitric oxide opens up the system. The parent essential oil actually helps the oxygen to get into the cells. Insufficient cellular oxygenation can contribute to cancer, heart disease, and cognitive decline. So again, I don't know if you're familiar with, we live in an air age and how important the element of air is so essential right now to focus on. And I think air-based health therapies are really central to our health living in these times. So technology, another thing about electrical technology, which can relate, you can say, to the air phase of things, is something called microcurrent, which uses amperage that matches your body's own electrical nature. And I find it very helpful for pain. It's also helpful for brain assistance using ear clips to apply that to the body. Body support, when you're feeling sick, you can apply the microcurrent to certain acupuncture points, which can help with recovering quicker sooner than later. And then sensory input technology. So this is where brain tap comes in and encourages healthy brainwave states. It does it for you. So basically, the brain tap, it sends bioneural beats into your nervous system. I don't know if you're familiar with that, but it actually has an integrative influence on your nervous system. So even the work that I do in the office with what's called the BEST technique, it's a sensory-based health technique where if we put good sensory input into the nervous system, good output comes out through the nervous system. HRV, heart math sensor. So HRV is heart rate variability. And with heart math, they've developed a sensor to help check that in that respect. So you can measure, you can have the self-discipline. If you have the self-discipline and to balance your HRV on your own. And when you get your heart beating and it's, say, correct heart rate rhythms, it actually brings what's called a state of coherence, which translates in terms of physical, mental, and emotional well-being. Now, for some folks, they're so sped up, they might not be able to do that for themselves. This is where I recommend the Brain Tap app because it does it for them until they can begin to do it consciously for themselves. Okay, and then there's other tools. I don't know if you've heard of the chi machines or a power plate there that shakes your body, vibrates your body there, which helps with bone density, but also helps get your lymph flowing there. So there's various other tools. Okay. Summing up our conscious care for health. So this is a quotation from a mentor of mine I thought to share with you. And in terms of sustaining our reason for being. The physical body needs control, it needs direction, it needs guidance, it needs care, it needs love. When this is provided, we become a whole person in position to serve and love, to extend love, and to radiate love to others. So it is, as we become responsible for our own physical bodies, we know how to handle it. We know how to take care of the requirements. And that's from a mentor of mine, Martin Exeter. Some of us are aware of him and his work there. But to recognize we're here to offer an influence. You can say, in essence, we're here to extend love to each other, which translates in terms of, say, sharing something consciously healthy with others, and share with others in terms of what you can share with others in a deep sense there, and what you shared in your breakout room together. Okay, let's see here. So bringing together meditation. So I know I just gave you a mouthful to digest, or a head full to digest. So let's just take a moment to bring it all together in terms of a meditation. So maybe you want to put your hand over your heart again. Feet flat on the floor, upright your spine. And let's begin to breathe in slow and out slower. And as we acknowledge the essences of what it takes to be healthy, physically, mentally, and emotionally, we affirm what strikes us in our consciousness. Breathing, breathing in slow and out slower. And as we affirm the steps we sense we might need to take, or what we need to continue doing, we recognize it takes something to stay healthy. It takes correction, it takes learning, it takes awareness, it takes consciousness. Breathing in slow and out slower. And as we settle into our hearts, relax, and come to a point of center within ourselves, we take note of these things. And we continue in a way that we can sustain our reason for being. Learning what we need to learn, applying what we need to learn, we need to do, and continuing and offering our love to others through however means we do that. Breathing in that affirmation, being of service, sustaining our reason for being, and breathing that out. Again, slowly, again, just breathe through your heart, breathing in slow and out slower. And just wiggle